Are you looking for a way to protect yourself from all of these infectious diseases that we're surrounded with now? Hello, my successful and healthy earthlings. Mihaela Ragushia, naturopath and founder of the Natural Health Podcast. In today's episode, I am going to discuss with you infectious diseases, how sleep and the immune system are interlinked, and I'm going to give you 3 tips to protect yourself from infectious diseases. And at the end of this episode, I'm going to give you an opportunity to join a health and success orange community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Podcast. We bring awareness to sustainable health in business hustle space. Natural Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. Absolutely love, and appreciate your support. Before we get started, remember to subscribe, hit the bell notification button if you are on YouTube, and do what you do best. Share this episode to everyone that you think is going to love it, because I know you're going to love it, and I know exactly why you're here, because of all of the infectious diseases talk, everything for the last 2-3 years that has been surrounded disease and our immune system. And all of those individuals didn't even know what an immune system was. Now they have been bombarded and they know what infectious diseases are. Let's talk about infectious diseases, right? So we know about a worldwide pandemic infectious disease. COVID-19 has been around. And what my question is are there going to be any more? Or is this just the start? Is this just one, and then there's version 1.1, version 1.2, version 1.3, which we've kind of already seen? And then I also ask you, is your body prepared? Are you prepared to take on these infectious diseases? Because as we have seen the impact it's had on some individuals, but also the whole world it's had, right? So I ask, is your body, do you have the tools? Are you equipped to deal what may be coming towards you? You've had a little bit of a taste. I know it sounds very depressing. You had a little bit of a taste of what infectious diseases are, but there may be more to come. So, all of these public health concerns and so forth may have, and not just may, I think it has raised anxiety around the whole world, raised anxiety for so many individuals. And then it may have also infected your sleep. If not your sleep, I'm pretty sure you know at least one person whose sleep has been affected this whole pandemic with this disease around us. Because anxiety is the leading cause of sleep dysfunction, and not enough rest may have a negative effect on your health, which is what we're going to be talking about soon. The link between the immune system and sleep. So sleep plays a powerful role in supporting a healthy immune system, your healthy immune system. There are 2 things closely connected. A lack of sleep can increase the likelihood of infection, but illness can disrupt your sleep. So I know when I'm not feeling well, all I want to do is lay down and sleep and be snuggled up and be in bed resting and wanting to sleep as much as possible. Or I use it as an excuse to catch up on sleep, which I shouldn't, which is so naughty. But or you aren't sleeping well, and therefore you may have a higher risk of being exposed to these diseases. It's a 2-way side, right? So, which in turn slows down your recovery time. So there's a number of things that can be taken into consideration. Consistent sleep better prepares your body to fight off unexpected illnesses, like the unexpected that's happened recently. And there might be more unexpected things happening. So is your sleep, are you prepared to take it on? Because getting enough of it supports your overall health and well-being. And we'll talk about sleep and immune system soon. But let's talk about what has kind of happened. So what's kind of happened is there's this infectious disease that's come about. A lot of people got anxiety. They didn't get enough sleep, so they were more likely to catch this infectious disease. This infectious disease interrupted their sleep and it impacted so many other things. So it's an ongoing circle, right? So what was the number one thing that I did to ensure that I'm protected? Okay, the number one thing I did is sleep every night. A proper quality optimal sleep. I ensured that, yes, whilst everyone was up watching Netflix, binge watching their TV shows, maybe drinking, maybe eating junk food, maybe not sleeping, I ensured that I was in bed and sleeping. That's the number one thing that I did. And what got me through it is sleep. And I tell everyone, they say, Mahela, what would you recommend? Sleep. It sounds so simple. And I'm like, broken record. Sleep, because I can prove to you every single time why sleep is so helpful. But let's go and prove to you one more time. Let's talk about sleep and the immune system, right? So sleep is your body's first line defense for infectious disease. Sounds really interesting, funny to some people. Interesting and funny to some people, but it is 100% right. Sleep is your number one first line defense for any infectious diseases. So during sleep, your body produces proteins called cytokines to fight inflammation and infection. So instead of taking a pill to fight these inflammations and infections, just go to sleep, and sleep will do its thing. You don't have to intervene. You just let it do its thing, right? So when you're exposed to infectious pathogens out there, you may have inflammation in your body, or you may be exposed to inflammation or experience chronic stress, which a lot of us have recently. Your body increases the production of cytokines to protect itself and from illnesses, right? So if you're exposed to something, it shoots off cytokines. If you're stressed off, it shoots off cytokines. So we all have a bad name, oh, cytokines are so bad, but they're actually kind of help us out, right? So sleep deprivation hinders this immune response. So let's say, for example, what happens is by increasing the risk of catching a common cold, so not getting enough sleep impacts your ability to naturally fight off infection. So you might be exposed to this virus, to this bacteria, whatever you're exposed to, and then that night you don't get enough sleep, so therefore your cytokines aren't doing a job of fighting it and reducing the inflammation, therefore it doesn't get dealt with, so the next day you wake up sniffly, right? So sleep disturbance has linked with early stages of infection, and irregular sleep patterns could signal that the body's beginning to fight off illnesses. So if your sleep is a little bit off whack, it's kind of like, are you fighting off an illness? A lack of sleep could also slow down your immune system response and allow illnesses to progress further. So it might be a stage 1, but without you sleeping that well, it might go to stage 3 straight away and hit that inflammation. Inflammation might go through the roof, and that's when a cytokine storm happens and so many other things happen, and individuals end up in hospital because of, they say, just a flu or because of just a virus. It's because their immune system just had this major reaction that it shouldn't have. It should have just been a natural reaction, but it had a major one. So essentially, the sleep-wake cycle has emerged as a prominent regulator of the immune system. The sleep-wake cycle has emerged as a prominent regulator of the immune system. Should I say that again? Or you kind of got the point? So if you're not sleeping well, your immune system is impacted. If you're not well, your sleep is impacted. So experimental sleep restriction studies show that sleep amounts are associated with alterations in measures of cellular immunity. So let's have a look at it. It implicates in risk of infectious disease such as natural killer cells activity, T cell proliferation response, all of this sciencey language, and with upregulated lutein and all this other sciencey language. Essentially, observational studies have also identified association between sleep disturbances as found in night shift workers or in those with insomnia and alterations in cellular immune response, as well as a biomarker of inflammation. I kind of say I'm going to be blabbing on about how good sleep is, and I can give you so many studies and so much research stuff in cytokine this, cytokine that, inflammatory this, natural T killer this, that. But if that makes no sense to you and you just want to know the basic is, for your immune system to function, you need to sleep. That's right. For you to allow your immune system to function the way it's supposed to function, you need to sleep. And if you're not sleeping, your immune system is directly impacted. Not directly or touched, it's actually impacted. Full stop, right? If you're already feeling sick, remember the old age advice, gets lots of rest, may be the best approach to actually support your immune system. So if you listen to your mom, your grandma, grandpa, dad, whoever your carer was or was around you who looked after you, and they said, rest up. Well, they were right. for you to rest means for you to recharge your batteries for your immune system to do what it's supposed to do. The benefits of sleep are both preventable, for prevention, but also for restoration and acute illness, right? They recommend look, I can sit here and say I recommend for you to sleep this many hours. It depends what you are going through. It depends male, female, age group, what your activity level is. Some athletes may need to sleep 12 hours a day a night. Some individuals may only need 7 hours. But I say you need to get more than 7 hours quality sleep. You must be biohacking your sleep to get 7 hours. That's optimal. 8, 9 hours of sleep. Like I said, depends what you're doing. Sometimes even 12 hours of sleep. Sometimes even naps, right? But you need to understand your body to understand how much sleep you actually need. I know it sounds crazy. How do I listen to my body? Well, listen to your body. Your body is telling you exactly what you need to hear. I'm not going to tell you what you need to hear. Your doctor's not going to tell you. Your body's going to tell you. So go to sleep when the sun goes down, and don't put an alarm clock on and see when you wake up. It's one of the little strategies. But there you have it. So 3 tips to protect yourself from infectious diseases, because we don't know if there's any more coming out, if this is the last one, if there's going to be more, if there's going to be less, whatever, you need to be protected. Okay, number 1 is make your bedroom a sleep paradise. Make your bedroom the place that you want to go at night, the place that you're excited to go to, the place that you're like, I can't wait to sleep. Number 1. Number 2, sleep consistency. So if you're going to sleep to bed 11 p.m. every night, go to sleep 11 p.m. every night. If you're going to sleep 8 p.m., go to sleep 8 p.m. Make it consistent. Number 3 is see light in the morning. As soon as you get up, go see the sun, go see the light, and reset your circadian rhythm. So there you have it. 3 little tips to help you prevent yourself from infectious diseases, because they may always be around us, okay? So there you have it. If you like what you heard, love, like, share the Natural Health podcast, hit the bell notification button, subscribe button if you're on YouTube, follow if you're on Spotify. I don't even know the rest of the things to do. Share, I don't know, do what you got to do, because this information needs to go out to the individuals that need to hear it. I'm here to provide you with simple, savvy, sustainable health hacks to optimize your health. So let's spread the word and do what you do best. Love, like, share Natural Health podcast. And also, so many people have given me amazing feedback on the Natural Health newsletter. I'm getting feedback like, oh my gosh, I didn't know this bonus was possible. Oh my gosh, I didn't know this free service, product was available. And you only get it if you're a member of the Natural Health podcast newsletter. And if you want to be part of it, click below, join the Natural Health newsletter, clicking the button below. Quite easy. Just put your name, your email address, and I don't ask anything of you. That's all I ask. I don't send you anything spammy after it. I don't try and sell you anything spammy. I just give you information, right? Why not? Okay, so there you have it. Thank you for joining us on Natural Health podcast. And remember, the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. And in no circumstances shall the Natural Health podcast, Mahela Raguse, any guests or contributors to the Natural Health podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Health podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.